We're going to talk about training plans and strategies. This fits into a series of bits of training that we do, which this is mainly around focusing on workforce plans and strategies. Now, the difference between a workforce plan and a workforce strategy is a little bit unclear exactly. What I would say is that a strategy always includes a plan, and a good plan always includes a strategy. It really comes down to the level of detail and the audience you've got for it most of the time. So we'll look at all of that as we go through this. And what we're going to look at is think about what the elements of a successful plan are, what a plan is, how we develop the plan, and then a bit of an overall approach to developing one, as well as looking at what one looks like. So for those of you that know what the wrapped redesign approach is, it's something which you can use as the basis for this approach, but we've got to sort of kind of a wizard or a shortcut through some of those different phases for developing a plan or a strategy. Whenever you do anything, really, you need to think about what we're doing it for and work out what is the point of doing a plan, because it can be a nice document in its own right, but we do need to work out what the hell we're trying to achieve. Key thing may well be, when is it needed by? How fast does it need to be done? What timescale does it need to cover? If people need a plan quickly, then it might change the way we do things. If people want a large-scale plan and they don't mind if they get it in a year's time, well, it might change what we do. We also need to think about the scale of what we're trying to achieve. So if we're coming up with a plan for a single team in a GP practice, for example, it might be a little bit different than if we're developing the integrated workforce plan for the entire Greater Manchester area, for example. So we just need to understand what scale we're trying to achieve, which might drive how much effort we put into it and how big the document is. Always worth thinking about what's the financial number at the end of this, recent issues with this. So understanding what, if we're developing a strategy, is there a financial environment we're working within? Because there's no point coming up with a strategy that doubles your workforce if there's no money available. Also, quite often, a workforce strategy needs to make some sort of savings, even if it is about keeping a cap on activity. So you've always got to understand what it's trying to achieve. A key thing to think about is, where can we get investment for this? If you've ever seen the film Jurassic World, there's a great phrase in it where one of the characters says, "need more teeth." And that's because there's a big dinosaur attacking goody dinosaurs. It makes sense if you watch the film. But basically, the idea is they release another dinosaur with more teeth, and that saves the day. So we always think about, where can we get more teeth from? So if we know where we can get the investment from, we need to understand what the needs of the people with that investment are, because there's no point coming up with a plan if we can't make it happen. And so therefore we need to think about where we can get investment to make this happen. That might mean, for example, getting a plan done very quickly so that we can get into the financial round for the next year, for example. We need to think about, is it possible? Is it not point doing it? And then the other thing is, let's focus on 3 big things that we can do, right? Always think about, what are the 3, 4, 5 big things that can form part of what we're trying to achieve, rather than making it lots of little things where possible. Always worth thinking about. So let's start with that. A plan or a strategy normally covers 4 areas. It normally covers background, context, why are we doing this? What are we trying to achieve? It normally considers where we are, what we call the current state. It focuses on where we want to be, the future state, and how we get there, which is basically, what are the steps we need to take from moving from current to future, and breaking that down into a set of things that we can do to help us. Even a good strategy will have a plan, and a plan needs that background and where we are at the moment to give it a strategic context. So that's what a plan is. Now, look at that lovely, very clear approach there. That's very, very simple. There is a kind of a simple approach that we'll have a quick look at as we go through the next few minutes. But the key things are mobilizing, interviews, document review, data analysis, a couple of workshops, work between the workshops, and then some stuff to finish off. There is a step-by-step approach you can take to developing a plan, which doesn't leave you doing this for weeks and months. You can do it over a very short period if you want to. First of all, thinking about developing the plan, you can develop a plan in an hour if you want to. There's nothing stopping you from doing that. You can just think in your mind, what is the context we're working within? What do you think is the current situation? What are your thoughts on where we want to get to? And what would you do as the key big actions? If you do that on your own in a room in an hour, you'll come up with a plan. You can do that better by getting more and more people involved, more data, more work, etc., etc., etc. The reality is, you've got to balance 3 things. You've got to balance the time you've got to develop the plan. You've got to develop the cost of developing the plan in terms of other people's time and other resources that you'll need, and the quality of the plan that is needed. If you need a massive high quality plan, it may well take you more time and cost. If you've got an infinite amount of time to do things, then you might be able to improve the quality of things. It's all about balancing those aspects of time, cost, and quality. You can get a complete system view by talking to everybody in the system to get all of their thoughts and make it more and more detailed, but eventually you get to the point where you've slightly overdone it. But you can always start with a quick view as to what you think the plan should be, and then steadily develop it by getting more and more people involved, so that if somebody does need your view on the plan quickly, you've already got one done. So first of all, how you develop the plan is thinking about whether you do it quickly or whether you spend time on it. There's a key point here about engagement and thinking about the plan, but the key thing is that mainly, as far as I'm concerned, people tend to know what the issues are that you're facing, and it's better to include people in coming up with ideas and developing themes for improvement, because not only are they the experts, but they're the ones it's going to affect, which is really good change management, and they're the ones that are going to be implementing it. So I think it's really good to get really, really strong engagement. Those people know the issues. There are different ways of getting engagement, and what I like to do early on in a plan is to get as much engagement as possible, which you can do by interviews or just chatting with people and asking them, do you think the issues are in the current state, etc.? What would you like to do in the future? What themes would you like to see? You can do surveys, or you can run a workshop. We'll talk about workshops in a bit in terms of developing the future state, but you can do workshops. There's all sorts of other things you can do, including suggestion boxes and all sorts of stuff like that. We've got qualitative data by asking people about what they think the issues are. What you can also use is quantitative data. The reason why you can use quantitative data is sometimes the quantitative data tells you things that people haven't told you. You can use it to test the hypothesis. So if people say to you, one of the problems we face at the moment is we've got massive sickness levels. If the sickness data doesn't bear that out, well, that helps you to try and test the hypothesis in that way. It also helps to frame the discussion. Some people don't believe people, they only believe data and graphs and stuff like that. So sometimes it helps you to frame that discussion by saying, we have been told about sickness being an issue at the moment, or retention being an issue at the moment, and it allows you to say, this is what the data shows us, and it shows a story. You also need the data, though, especially in things like retention. People might say retention's bad at the moment, but it might well be that retention is only bad in the BAME community within your teams, or a specific gender, or it's bad in the first year when you join, which tells you different things than it would do if it was spread across all groups, etc. Quantitative data also allows you to assess the benefits in the future. So if people say that sickness is bad, if we can look at it and say, right, we can see how bad sickness is, then that can help us to assess the benefits in the future. So you've got the quantitative data, you've collected qualitative data. Another great thing to do, going back to that sort of set of things we can do, is looking at a document review and looking at good practice. So that's another thing you can do early on. The great thing about doing a document review is that you can get issues and solutions from elsewhere, which gives you and other people confidence that these things are doable, because in the NHS especially, it's always the second mouse gets the cheese, or certainly people tend to think that way. It helps you to expand people's thinking. So it's the old thing, of course, of saying, what if you ask people what they want at the turn of the century, they'd have said a faster horse, they wouldn't have said the motor car, for example. So by providing different ideas, what other people are doing, you can expand people's mind a little bit and help them think a little bit differently. It can help us understand what is going to change by looking at the detail behind what other people have done, and it can provide these models for implementation. Not a great fan of benchmarking, as we always say, all benchmarking is evil, but if you can identify people that have done it before, people do love to talk to people that have done it before, and you can get that data. And the key thing whenever you're doing a document review is always, I would say, write down what documents you've reviewed, what the title is, what the documents told us, any reference data, collect links for these things. It looks good in an appendix, and it helps you to work out what you've actually reviewed and prove to your bosses that you've actually done some work while coming up with a strategy. So current state, what you've been able to do is to get a quick view of what people think, and you've got some data which helps you to work out what the current situation is. Now, then you've got to think about the future state. What does it need to look like in the future? Now, future state planning very, very quickly can be done in a couple of ways. You can put in a full plan to say, we're currently here, we want to get to here, and therefore these are all the steps we are going to take to get from here to here. But you can also just say you've got a bit of a view on what the future might look like. So actually what you're developing is a plan to get to a plan. So you say the next steps are going to be, we're going to do more detailed engagement to do X, Y, or Z. I don't know if that makes sense, but there's a difference between doing a very full plan with every step and a plan that says, actually, these are the steps we're going to take to get to a plan. When you've got a view on the future, when you think about what you want to do in the future, then you need to make sure that everything is going to be done. So you need to think about what are all the steps, what are the changes that are actually going to happen. Sometimes we call those interventions when we're doing new hospital planning, for example. When we do that, you need to make sure that every one of the areas has a named lead. It needs to make sure that each one of them hopefully has some named resources or team to help them do it, that they've got an outline plan to actually implement that thing. So, for example, if one of the things we want to include in our workforce plan, implementing smart rostering, for example, then we need to make sure that we've got the right resources to do it. We need to make sure we've got a pro forma for each of those areas, so a single page which explains what we're doing and a view on how that's going to be implemented. And it's always worth asking people what the resources are that they need, what's the governance going to be to actually make sure this does get delivered, and what's the overall plan, what metrics are they going to use, what are the estimated benefits, and what work is already being done. And you can do these in a workshop with people, get lots of people together to think about what they think the plan should be to inform the people who are actually doing the planning themselves. So you come up with a current state, you think about a future state, and then you work out the different aspects of it. Just to put all of that stuff in context, the way that we tend to look at an approach is to say we mobilize, first of all, we make sure that we've got a proper team together who can do this work. We know when it needs to be done. We know what scale it needs to be. We need to know what the answer perhaps should be, and an initial view on what it might look like. We then do some interviews or other ways to get a view from people as to what they think the issues and the answers might be. We can do a document review. We can do some quantitative data analysis, and we develop our pre-workshop views before getting everybody into a workshop and getting them to think about what their thoughts are around the issues in a group, setting priorities, and doing some group solution planning in the first one. The reason why I tend to do that is you've done some pre-work, you're not asking the questions as if you haven't done anything in advance. And if you do stuff in advance, you can get onto priority setting, you can start to list things out. Whereas if you just ask people in a workshop from scratch, it's a bit more difficult to do that. But you can do all of this in a series of 3 workshops where you just start with everything together, get people's thoughts first of all. And as I say, between the workshops, you can do a little bit more work in between each, agree the leads. And then in the second workshop, you can spend time working out more detail about what the future looks like and then come up with a future plan. Then you do the final stuff, write it up and validate it and communicate it. So there is an approach. There's more information on that and much more detail in the book of Health and Care Workforce Planning and the document. So what does the document itself look like? And now some of you in this room have done some great documents in your time in terms of actually what a document might look like. I can't really show you other people's documents, but I can show you what tends to be included in one. So the document itself will be different if you're doing a full-on plan, you've done every bit of detail, or if you're still in the sort of point where you're getting as a plan to a plan to get to a plan. So and the document can be different sizes and it might include different things. But every document will include background, context, etc., include a view on where we are now, where we want to get to, and how we get there. More detail than that, then the document needs to consider summaries at different times, which we'll talk about in a second. It needs to consider, it should include the background to the work, the current, the future, the case for change. So why are we changing? It's one of the key elements for change management is why are we changing? The individual plan, and then a number of appendices. And it's those we'll talk about now in terms of those different elements to what should be included in each of those. Summaries wise, whenever you're doing a document, you need to consider the executive summary at the start. Some people will only read the executive summary. You might want a 1-page executive summary and then a 5-page executive summary or whatever, but sometimes people will only read the summary. Some people, like the chap on the right, were elected to lead, not to read. They just want the summaries. What I like to do is to have a summary for each section as well. So there's a summary for the background, there's a summary for the current state, there's a summary for the future state, there's a summary for the plan, and you put those summaries together. But you can have all sorts of levels of that. Always worth considering because a number of your audience will only read those bits. The document itself will include background. When I'm looking at background, I like to consider a number of different things. I like to look at the international background where possible, the national background, the local context, and the reason for the change. So in the UK NHS, it's looking at what does the long-term workforce plan tell us. Hopefully we'll have a new one soon. Any international stuff that's relevant to it. Anything local, so that could be regional, it could be at ICB level, and then anything within the organisation. So you're trying to think about what is the background to this change from an international all the way up to the most local. And a key thing to have in the background is, why are we doing this change? What is the driver for it? Okay, is it financial? Is it we're running out of staff? It's always worth understanding what is the reason for the change. The current state can include all sorts of things, really. It can include pest analysis or PESO analysis, political, economic, social, technological, legal, and environmental. Thank you very much. All of those are different areas. So looking at why, what is the background to any of this stuff, the current situation in terms of all of those different aspects. It can include information on activity that's going on. So in terms of the growth in activity, the changes in activity, it can look at the locations and the facilities that staff work in at the moment, or where staff deliver care from if it's relevant. It can include, if you want, the equipment and the IT that they use, the list of systems or the list of equipment, if it's relevant. It can include organisation charts. It can include, and definitely should include, issues that staff have based on quantitative information and data, and it should have the information on the current issues with regards to qualitative issues, and you should also be highlighting and summarising those staff issues together, so matching quantitative and qualitative. It says issues there. Another key thing to do is to consider strengths as well. So you might want to consider the strengths. What do you want to keep? Plus, it can be a bit depressing when you just look at the issue. It's always worth considering the strengths as well. You're also going to want the current staff numbers and a description of that. You might want process or flow charts as to how people currently work. And you might want wider workforce issues that are not relevant to the issues necessarily directly, but are wider workforce issues that may influence or be influenced by your changes. So your current state can include a lot of things. Only what's relevant, though. You don't include everything, obviously. But don't forget, from those of you that have looked at what is workforce planning, when it comes to workforce redesign, the location, the equipment, the digital, the structure, the process can be as important as to whether it's done by a nurse or a social worker or whatever. In terms of the future, I like to have a bit of a story, and this is how I tend to set things out. So I always start with, okay, at the moment, the current situation, it's a bit like a film, right? A current situation, oh, it's a bit dire, oh, we've got these problems. And if we do nothing else, it's going to get worse. Yeah, you thought it was bad before, but it's going to get worse. So if at the moment we're saying, oh, we've got a shortage of staff at the moment, we can say in 10 years' time, if we do nothing, what with retention problems, etc., we'll end up with even bigger gap. And then I look to say, but if we look at the opportunity that we've identified, so the good practice, the document review, etc., try and bring that in to say things will get better, and then play into that as something that says, right, with all of this stuff together, we will see an improvement. So you're trying to tell a story that says interim if we do nothing, and then in the future, things will get better. And then we're trying to show what it will look like, which might involve a new organisation charts. It might involve a new process. You might have done a workforce model alongside your planning, so it might include that. You're certainly going to be showing what the workforce actually looks like in terms of numbers and roles and etc. And then you want to list out the other supporting changes that are going to happen in terms of retention changes, well-being changes, etc., etc. So you're trying to tell a bit of a story with it when you get into the document. So that's what I mean by the future. And now, we mentioned this before, but I'll say it again here. Quite often when you come up with a plan, you end up in a world where you know you want something and we need something, but you're not allowed to have it because of the finance. And when you're developing a plan, you want to make sure you're working within the envelope you have, etc. So if you are looking at things that need happening, either stuff that needs to be done to improve things, but you're not going to get the funding for it, or you need more staff in the future, but you're not going to get the funding for it. An approach that Manchester took when we developed the strategy across the whole system was to show a number of different scenarios. So the plan said, oh, if we just increase the activity, we're going to end up needing many, many more staff. We said the document review and the look at the world tells us that actually the number of staff really needs to rise only slightly, but we really need to consider the efficiency and the improvements that we need to put in place. But the financial situation is that whilst we're allowed to get a few more staff this year, it needs to reduce heavily into the future. And those are three things that people want to see happen. But it's different stakeholders wanted to see that happen. And sometimes your plan or your strategy cannot come up with one agreed strategy or way forward or plan way forward. And sometimes you've just got to show that there are differences in the way the future might plan out and just show the key elements that you're going to do to try and improve things over the time. So just a quick note to say sometimes your strategy cannot be all things to all people. So sometimes you've got to show different scenarios depending on whether you get investment in certain things or not. So the future, when it comes to the future, in a plan or a strategy, you often really want to be showing something exciting, something great where possible. So it's certainly worth really having a vision that really brings it alive. Now, I'm really bad at this, so sometimes it's good to get sort of marketing-y type people involved in this. Sometimes people that can paint a real picture of what the future will look like will get more people engaged in actually making it happen. You want to list out the benefits, financial and other. But financial is always going to be important because you're almost certainly going to want a bit of investment in this and someone to actually do some stuff. And then really being clear to individuals, this is what you can win. One of the key things that's often useful for people is to say, but this is what is in it for you. And set out the alternatives, different alternatives for the future if you need, in terms of where it can go from here, if you still need to get agreement on what it is. Implementation wise, from a point of view, you need to make sure we've got a clear view on who is doing what. So any implementation section of a plan should include what are the projects, who is doing each project, a description of each project. They can include a plan, which may include a Gantt chart, because people love a Gantt chart. They never ever get delivered, but people love them. The expected benefits, any assumptions or risks, dependencies, for example, and any costs or assistance needed. I always argue that any change will have some sort of cost involved. Any improvement is a spend to save, so you need to include that in there. And you also need to consider is going to be governed so it is actually delivered. Even if it's just a page that says the way we will make sure this happens is that we will report into a monthly steering group who will ignore us, not turn up regularly, have different people in it, etc. Or you can be less honest and put your governance point in there. We can also mention if you're introducing a hub, which we will talk about on another session. But hubs are a great way of bringing the governance together. Finally, I think pretty much the appendices. You can have quite large documents if you want, and some people like large documents. What we tend to include are things like the people we've engaged, the process we followed. We might provide a complete list of all the documents reviewed with the links to those documents. We may or may not include the workshop outputs where we've been asking people what their issues are and taking people through the steps that we went. We might include much more detail on the data, especially the data that wasn't relevant, particularly relevant to our case. We might include that, and we might include detail of various other things as well. So these are all things. It very much depends on what you need. You might also reference any business cases, reference detailed workforce models, and reference any engagement and consultation documents as well. And we don't tend to include those in because they are difficult to get into a document. But you might also want to reference those other things that you've done as well.